And I had a new stepfather. He mistreated and was quite abusive to me. It just made me hate myself like deeply, especially being a boy. Like I could not envision myself growing up and being an adult gay man. Like I was like that. I was the gay boy. I was like the token gay boy that they like to pick on.
How does that happen where a 12-year-old comes into the doctor's office and says, I think I'm a girl?
I had the prescription for the hormones, and I had the blocker injection as well.
Within 30 minutes,
Mhm.
negative sexual experiences maybe played a role into you not appreciating your genitalia as it was.
The penile inversion wouldn't be ideal for me.
Diabetes, heart disease, death.
Then immediately it was sent for insurance approval to get pre-approved, and it was within about 2 weeks.
For you, it's a little different because you had a 7-hour reconstructive surgery.
I was bleeding a lot. I would stand up and immediately lightheaded, and I passed out like almost every
Wow.
single time.
The interesting behavior from the hospital staff after the surgery.
Because I was the youngest person they'd ever seen to do this. He brought in other residents, people to look. So celebratory of something when I was going through so much pain. But I just wasn't even fully aware that things weren't going right. I thought that this was just complications. So a large clots in the legs. It was becoming more and more painful every single week. And it felt like I was shredding like the inside of my body every single time I did it. So that was when I called Dr. Roth, and I was like, I need to come in like 3 months away from a year.
Right.
And this is where I'm at. Like, I don't know what's happening, that I don't have functioning genitals. There's nothing about a transition that's reversible. So having something that is completely closed and also doesn't look really fully male or female, even though it looks more female, I would just look at myself and I'm like, I don't even feel like a person anymore. And I did all of this to feel like a normal person.
The following is an interview with transgender model Briana Ivy. Because of the length of this interview, instead of editing it down, me and Briana have decided to split it up into 2 parts. The story is extremely important to tell, and editing it down to an hour or an hour and a half interview does not do the story justice. People need to hear Briana's story in its full form. Part 1 will air today, and Part 2 will air on 8 p.m. on Sunday night. In the last couple of years, we've heard a lot of back and forth about the efficacy of gender-affirming care. The transgender movement says this is the way, medicalization is the way, and it's not always the case. Briana's story is a reason why a one-size-fits-all option doesn't work for everybody, and why mental health awareness is the best way to move forward when it comes to things like gender-affirming care. This is Briana's story. First of all, Briana, I just want to go ahead and welcome you. We've been talking already off camera for about like maybe almost an hour.
Right, for a minute.
Right, almost a whole hour. I already did this and we had the whole like real actual conversation, not the fake thank you that I'm about to give you on camera. But again, I just want to thank you for coming on and having this discussion with me. There's a lot to talk about. We've been texting for like a week already and you've been so sweet and so nice. So I just want to thank you for everything that you're going to do today in terms of your vulnerability and just being honest about your story.
Thank you so much. I want to thank you for having me. And yeah, we've been talking for about a week. You are so amazing, so kind, like such a real friend. And I'm excited to actually have this conversation. I feel like it's going to be a lot more raw, a lot more honest, and not so confined to like one political point or topic. I think we're actually going to be able to just have a real discussion about everything. So I'm really
Absolutely.
excited.
We have a lot to talk about today. And I just want to kind of jump off from where I first, I guess I should say, came across your story. I believe you mentioned already that the interview with Buck was first, not the interview with
Mhm.
Candace.
Yeah.
Yeah.
So the interview with Candace was planned first. But the Buck one just kind of popped up because I followed him and he followed me, and I don't even remember how it came about. Oh, I think I had started to share a little bit about talking to Candace, and that
Mhm.
interview was going to happen, what I was going to talk about. And then that was how I got connected to Buck. Someone suggested that, like, oh, I reach out to him. And so I actually reached out to Buck. And
Okay.
then, but it wasn't even to do an interview. Like, it wasn't because I wanted to like do any interviews. I was terrified. I was actually really terrified of even like sitting, like thinking about that.
Mm-hmm.
Um, it was really just to like share him that story, ask if he knew of anybody. Like, again, asking for legal advice was really what I was reaching out to him for, just like I did with Candace. Um, and also just to tell him like, you can use this story if you want to like talk about it, or for whatever reason, I don't mind that. But yeah, it was never me asking to like do an interview or be in a video. But he ended up asking me, and he was really kind, and so I thought it was a good idea to talk to him first, especially because he's also a trans person.
Right. Of
And so I
course.
felt like he would understand things more than anybody, especially like before I talked to Candace.
Yeah.
I thought it would be good for me to talk to him, and it definitely was. I'm really glad I did.
Yeah, it was a really really good and touching conversation just because of course like Buck is coming at it from a, he actually kind of knows similar to what you went through.
Mhm.
Obviously, it's basically opposite side of the coin as you guys transition to be different genders, but
Yeah.
you know,
Mhm.
it basically all kind of reflects the story, the stories perfectly well. So you guys definitely had an awesome conversation, bounced off each other great. But I
I'm
personally found
glad.
you through the yes, it was awesome. I personally found you through the conversation with Candace, and
Mhm.
it was extremely touching, just emotional, gripping. It was extremely tough to watch at some points, just because
Yeah.
of how you know how deep you got into the story and everything that's happened to you.
Mhm.
And I've said this to you already, but I just I appreciate you for being so vulnerable. There's so much like I feel like you're one of the first few people that has ever actually told a story like this. So it's a really really important
Yeah.
conversation. I saw the video and I immediately was gonna make a video on it. I was gonna make an
Mhm.
actual video on the story, but I was like, you know what, let me shoot my shot.
Okay.
And right, and I
Well,
sent
look,
you a
back here
DM.
I am.
Yep.
Oh, yeah.
And I
Well,
sent
no,
you a
thank you.
DM,
Thank you. I'm
and
so
here we
glad.
are.
I'm so glad you liked it. And it's so funny, like just a random little thing, but like that was not my intention at all. Was to like, I did not know how like what the structure of the interview was going to be. I honestly thought it was going to be about 20, 30 minutes. Like kind
Mhm.
of like what her regular show is. It
Yeah.
was while I was there and I was backstage and they were like doing the makeup that they were like, "Oh, it's actually going to be an hour." I was like, "Oh, okay. So it's probably going to be like a sit down, we go over like everything." I didn't know if she was going to come at it like in a critical way, like kind of push me to like see did you really need to transition, did something like I just didn't know what angle they were going to go at it with. um and I was actually, my mindset going into it was I did not want to be emotional at all. I was
Mhm.
really scared of being too emotional because I thought people would interpret that as me being still mentally ill.
Right.
I know it sounds weird, but like
Yeah.
I didn't want people to look at it and they're like, oh, this person is clearly like not even stable. And so I didn't want to fuel the idea that like we're all just like mentally ill, just and just out of our mind. And so I was really nervous about being like showing emotions in it. I wanted to come off really rational, clear headed, really focused, there to just kind of deliver that story. Um, and it was really unintentional that that kind of happened. I think it was just one, I was extremely nervous. Like there were multiple points before we filmed that actually was really nice. Candace like came, she was like right next to me and she was like, I can see that you're shaking. It's okay. Like this is going to be a conversation with you and I don't want you to be nervous. Just look at me the whole time and it'll be okay. So
Yeah.
she was actually amazing, like really supportive. Um, and I think it was just the intensity of it all, like just being on that set, all these people, all these cameras, people filming, she was there, and it just kind of happened. And then, yeah. But I think that honestly, that was for the best. I think people saw like what it looked like for me to actually I think people got to see the emotions that I was actually living at the time
Yeah.
when it was happening.
I
Mhm.
agree. It was a very, I'm gonna do my best to guide us through the conversation in a way that will be, like you said, a little more raw, a little bit more in depth, a little bit more, down to earth in terms of how we're going to be discussing, your situation. But just in general, even with the length of the interview itself, like it was very, very emotional, and like I said, it was just, you could sense the vulnerability in both parties. It wasn't like, it didn't feel like she was judging you. It didn't feel like there was a sense of superiority during the
Mhm.
conversation. It was great, and that's part of the reason why I wanted to invite you over to have the conversation, because I do really genuinely believe that things like this need to be discussed in long form. There's no way for us to,
Yeah.
chop this up for a 30-minute, hour long, daytime talk show interview. There's just no way for us
Yeah,
to do that.
no.
There's so many things to this story and so many layers to it specifically, that it would do you a disservice, and it would do a disservice to the people watching this that could be influenced by your story, to sit here and have like a surface level bullshit conversation about, you had a hard time. there's there's
Yeah.
there's a lot more to this than it was difficult. So, again, I'm really glad that we're going to do this, and I just want to let you know, and let the viewer know, you were just immediately forthcoming about doing this. And I say that because I think a lot of people, when you're open about something that goes against the grain that we're seeing today, people, and you've already discussed this with me, people are calling you a pick me. I'm sure that you're probably getting grifter comments,
Oh, yeah.
right?
Oh,
All
yeah.
of these
Mhm.
ignorant comments coming
Yeah.
towards you. And I just want to let you know, there's a reason why we're going to sit here and have a long conversation. And it's not just because I want you to tell the full story. It's because a lot of people think that this isn't happening. And it is. There was
Mhm.
somebody in my comments that I was responding to this morning that was asking, that was telling me, the beginning phrase was, "Why are you transphobic?" And they were calling me transphobic because I said that they're pushing child transition on children. They are. And obviously not everybody is going towards the route of full medicalization, but like we're going to discuss, a lot of
Yeah.
children are. And while that does work for some children,
Yeah.
it doesn't work for all of them. um
Absolutely.
and
Mhm.
and we're not going to dive too much specifically on right now on whether or not, children should transition or not. We're not here to have a fully politically based conversation. It's not the point
Yeah.
of this conversation, so we're not going to go too much into that. But it's happening is my point.
Yeah,
And in the
absolutely.
comments it
Mhm.
was, "This isn't happening." Oh, and one of the things that I do want you to know is that, according to this person, from one of the comments that they left, because they left a row of comments,
Oh,
according
one of
to them,
those.
it's fully reversible, puberty blockers and the surgeries. Just want you to know, if you want to read that over my comments later, you can. It's fully reversible, by the way, in case you were curious about that. But,
That's
you
happened
know
to me and you're
going into
I
the go ahead.
Oh, no, sorry. That just blew me. Like, what do these people think it is? What do you think it is?
Yeah.
What do you think a 7-hour reconstructive procedure is even actually like?
Yep.
What about that's reversible? Like,
Trust me, we're gonna get into that, and
yeah, we'll
they're,
get there. We'll
they'll
get there.
they'll understand in just a moment why we are speaking so passionately on that subject, because it is not something that is reversible. But, I do want to start from the beginning, and I do want to ask you, because from the sounds of it, it seems like your family played a really big role in your transition, and, part of the main reasons why you decided to start, questioning things in the first place. So, can you kind of just tell us a bit about your childhood and kind of leading up to the first thoughts of confusion?
Yeah, so definitely childhood was it's not something I always reflect very fondly on. Um, my dad was pretty he was there up until I was about 3 or 4. And then he became really distant after that. He left my mom, and we did have visits after that, but it just every single time it just decreased after that. And so I really lost genuine relationship with him at all. And he became pretty detached. And so then I had shortly, I think I was probably about 6 years old. Yeah, I was 6. And then I had a new stepfather come into the picture, and he was not a great person. He mistreated and was quite abusive to me and my mother and my sister as well. And It was around that time though, like when I had started also like first grade, like going into elementary school. And I knew pretty much right away that I was like very different from like all the other boys around me. Like
Mhm.
not even just in like we have a different personalities way, but like you just know. Like I just knew in my core that there's something here and I don't know. I'm just not like my brain's not developed enough to explain it. But I know that there's something very different within me that's just I'm not seeing in the boys around me. And I even started to have like little things where like I was always a very feminine kid. I was always friends with girls. My two best friends that I had in elementary school were girls. I always hung out in like other girls like during recess and like all the time at school. They would have boys and girls like line up and I would always go with the girls line and they were like, "What the
Mhm.
hell are you doing?" And so it was just like all those behaviors there that kind of are very common like indications of questioning like a gender identity. And not only that, but it was not only those innate like traits and behaviors within me, but it was also I was also having some pretty negative experiences with men and boys. Specifically, it was very hard on me. My dad becoming like really detached and just kind of absent, and then having a stepfather that treated us the way that he did. And he was pretty hard on me because he did not like any feminine traits about me. He
Yeah.
thought he thought that my mom kind of enabled it. So like he thought that like by her just letting me be like that
Mhm.
was a problem and that she was setting me up to be gay. And so there was that going on as well. And then what also happened was this happened when I was in elementary school and middle school. I was, you'll probably have to censor this, but let's just say I was sexually abused by an older boy. That happened to me in elementary school. And then it also happened again in middle school.
Okay.
And this, this is something I even still think about to this day. It was very dehumanizing. And especially because I knew it was because of just who I was. It was because of the fact that I was always with girls. Like I was like that. I was the gay boy. I was like the token gay boy that they like to pick on.
Mhm.
And I knew that it was because of that was why it had happened. And it just made me hate myself like deeply, especially being a boy. I and this was like a slow development from me being a kid, like really young to as I got older and became a teenager. It
Mhm.
was growing like over time, this like hatred I had of the thought of me being like a gay man. Like I just couldn't see myself, like I could not envision myself growing up and being an adult gay man. I just could not see it in my brain anymore. I did not like the idea. It made me so uncomfortable to think of myself that way. And even though that's really what I was at the time, like I was a boy and I knew I was attracted to boys at a pretty young age. And just the thought of me being a gay man, it was just terrifying to me. I don't know why. I just started to hate like my male everything, like all of my male traits being in a male body because I just didn't feel like them. I didn't feel like boys liked me, boys saw me like in on the same level as them.
Right.
Um and then I always felt like my dad was disappointed because I was so feminine and I wasn't like a son that like he envisioned. And then he was kind of out of the picture and then my stepdad didn't like me because I was such a feminine boy. And so I just developed this like deep sense of self-hatred for me being a boy. And then it was when I was 12 years old was when I was exposed to like transgender people online. And really the big thing for me that even really had me thinking was watching the Jazz Jennings interview with Barbara Walters.
I see. And
Mhm.
and I want to ask you, do you think that, of course, sexual assault plays a big role for a lot of people in not just like their development in general as a human being, but there's
Mhm.
often a lot of times where it's mentioned that sexual assault can play a role into the way that you view yourself and your sexuality and the way you view um,
Mhm.
your existence as an individual. And a lot of people who go through an experience like that find themselves in difficult situations or find it even difficult to put themselves in sexual situations. So
Yeah.
I could imagine that that of course influences your view of yourself and of course your view of your gender as a male at the time.
Yeah.
But how do you think that such open displays of homophobia affected the way that you viewed yourself as a child?
Yeah, it made me hate myself. Like, just being fully honest, like, I did not like anything about me. I thought it was disgusting. I
Hmm.
wasn't disgusted by other people, it was me. I just did not want to live that way. I just could not see myself becoming an adult and living like that. It was so like, my brain just wouldn't accept that as being a real possibility. And I honestly wouldn't like, I had the thoughts in my brain that I was like, I won't let myself live an adult life like that. And
So it's almost like you went into like a suicidal ideation phase where you
yeah,
started possibly like thinking that it wouldn't just alter your life, it would end your life if it was a path that you decided to take.
yeah. That was exactly what I was thinking when I was in middle school. I was like, I will not there's no way I can live an adult life as a gay man. There's no way I can live an adult life as a man.
And speaking of Jazz Jennings and kind of touching lightly on the topic of
Mhm.
um finding out about what transgender is and what it takes to be transgender, when did you begin to cross the bridge between, okay, maybe I'm not a boy, to I need to start being a girl, and
Yeah, so
why?
oh, yeah, I was 12 was when I was exposed to I found, like, older trans people online, like, on YouTube that made videos and kinda talked about it.
Mhm.
I but really, like, the big shift for me to start thinking about it was watching Jazz. Watching that Barbara Walters interview, like, something just clicked for me, and I was like, "I can see myself living as a woman."
Yeah.
And I can see myself living as, like, a trans woman, like, an adult trans woman that is straight, rather than me being an adult gay man. I just could not even, like, fathom an adult life like that, but I immediately could see it in terms of transitioning into a straight woman.
And how does a 12-year-old, you know, we've gotten into, of course, the first initial thoughts of confusion and going into thinking that you were possibly transgender, but how does a 12-year-old muster the courage to go and tell their parents that they're a woman? How did that happen?
Yeah, it was hard, and it honestly was pretty quickly after that. I because I was on the edge of giving up. Like, I really was. I felt so I was at such a deep point of rejection from so many people and through all the experiences I had had, then even just that rejection of my own self, that I knew I was like, this is I think this will fix it, and this will make
Mhm.
me finally feel complete in a way that I just never have. And it was really out of desperation. I was like, I need them to know now. And especially because I was seeing a lot of older trans people online, and they were all wishing that they could transition younger. There was always that kind of point that if they could change anything about their transition, they would start it as young as possible. And then seeing Jazz Jennings and how much she looked like truly biologically female,
Mhm.
and how young she started blockers and hormones, it just gave me this sense of urgency that, like,
Right.
I'm already at this age, and they made it feel like a ticking time bomb, like, in terms of, like, getting on the hormones, that it was like every second you let go by and you don't, you're losing changes that you could have happen. And so I had this sense of urgency that like if that I need to do this as soon as possible so I can have the best outcome and have a better life in doing so. And so I
And
went and I
so
told them pretty quickly.
yeah, it sounds like it was a pretty a pretty small amount of time where all the developments
Mhm.
happen. And at this point, how did you find a doctor? Did you just go to your regular urgent care and ask for a specialist? What was the How did you explain this to a medical professional? I mean, we're both pretty young. You just turned 23
Mhm.
years old. I'm
Yeah.
21. You started when you were 12, so you've discussed with me it's been about 10 years. 10
Mhm.
years ago, we're speaking 2013.
Mhm.
How does that happen where a 12-year-old comes into the doctor's office and says, "I think I'm a girl"?
Mhm. So what happened was when I told them, I told my mom and my stepdad, and my mom didn't even know what a transgender person was. I remember that was like she told me that that was her first thought, was that she had to ask my stepdad, what is that?
Mhm.
And so then it was pretty clear to all of us that we didn't know anything about trans people and we didn't know what to do. And so in that time before we went to the clinic, so I was 13 when I actually ended up telling them, like I was thinking about it, like I was slowly thinking, questioning myself for a few months, but then it was when I had started to see more trans stuff and I was already 13 at the time and then I had told them. And before we went to the clinic, I was socially transitioning. So I was already slowly changing the way I was dressing. I was actually wearing makeup already. I was
Mhm.
one of those boys.
Mhm.
Um, and so I was already doing that, but then I was starting to change the way I dressed too. And I was also starting to change my hair as well. And we, so we didn't know what to do medically. We didn't know how to go about that actual process. And so my stepdad told me that he asked somebody that he knew, because he knew somebody that worked at something called a gender clinic, and apparently they had done like an internship there. And so he was like, I've heard of somebody that's interned at something like that. And
Okay.
so he went and asked her just for the details, and we found out where it was, and it was downtown, in a place called Eskenazi Hospital, and it was a gender clinic within the hospital. And so it was there that we were able to schedule like an initial appointment. And that was when I got there. And my first appointment was with a clinical social worker. And I was with her for about 30 minutes. And she asked me like some different yes or no questions. I told her that I was like, I want to transition. I am transgender and this and that. And she just kind of asked me some yes or no questions about like, are you uncomfortable with your body? And like, just kind of asking me if I was comfortable or uncomfortable with certain things related to gender. And
Mhm.
so it was from there, it was about 30 minutes, and she diagnosed me and said I had gender identity disorder, like I think maybe that's what they were saying at the time. I know now they just say gender dysphoria, but I think it was gender identity disorder, was what they had said to me.
Wow.
And
30 minutes.
yeah, and then I had the prescription for the hormones, and I had the blocker injection as well.
Within 30 minutes.
Hmm.
Wow.
Yeah.
And I really want you to touch on this because I'm glad that we kind of stumbled upon already the people that decided to start making these, basically helping you make these decisions, because it sounds like you couldn't
Mhm.
have made the choices without their opinions based off of the way that
Yeah.
they
Yeah.
spoke about things.
Hmm.
Can you, speaking of the doctors themselves, I really want you to talk about this because for most people, most of the doctors that we come in contact with as people, they're private citizens, they live their lives privately, but your doctor, or at least one of them, is now TikTok famous for advertising and talking about procedures like this for other people. So can you talk a
Hmm.
little bit about Dr. Gallagher, and of course, I mean, following that, your experience with, I believe it was Dr.
Wrong.
Roth?
Yeah.
Yeah.
So Dr. Gallagher and so I so they were only related to bottom surgery.
I
But
see.
all of my the doctor that prescribed me hormones and blockers, she was just a primary care doctor within the clinic. But Dr. Gallagher specifically, that I came in contact with her because I saw her online. She had had a social media presence before I don't think she was really prominent on TikTok at the time. It was about, I want to say like 2017, 2018, when I was already starting to look into it, like having bottom surgery, because I
Mm-hmm.
knew in the clinic that they were like, it's something you'll want to plan for, so that way you'll be prepared for when you're 18 and you'll be able to get it. So I was already starting to do research because I knew that this was going to be different than like getting breast implants or something like that. Like it's a longer, like it's something that you plan for a little bit more. And so I started to just look into different surgeons, and that was how I came across Dr. Gallagher. I just saw her name so much because she made YouTube videos and she talked about it a lot. And so she was the person I wanted to contact because she was also in Indianapolis at the time. And so it just seemed like it was a perfect fit that there was someone already with like a social media presence, and she's also right here. And so that was who I reached out to for a consult, was with her, and that was in, I want to say that was like late 2018 or 2019 when I had that appointment with her.
And just for the viewer, I do want to mention this, just because, we kind of, I skipped a bit and went into the bottom surgery, but
Mm-hmm.
just to kind of let the viewer know and the listener, at this point, you had already had, at 18 years old, you had your nose and your breast done, and then at
Yeah.
around 6 months
Mm-hmm.
after that is when you went through the process of the bottom surgery. But at the bottom and the hip augmentation, I believe you said the butt and hip augmentation.
Yeah. Mm-hmm.
Yeah. So at this point, you already have your nose done, your breast done. You basically already started the process of, transitioning to be
Yeah,
the
like
gender that.
surgically transitioning. Yeah.
Right. Exactly. And at this point, how was the necessity, because you've touched on it lightly, but I would like you to go a little bit more in depth on it.
Mm-hmm.
How was the necessity, the necessities, I guess I should say, of these surgeries explained to you and your parents? Because I know you've mentioned how insistent they were about the process having to start very early.
Mm-hmm. Yeah. And so what happened with the surgery side of things and like where that kind of came into the picture was I was already on the hormones for a couple years, and like just so like so people understand kind of how that worked, was they basically told me that like they would start hormone replacement therapy, and then they told me that a part of that, especially for my age, was to have the blocker, and then also you have to take a testosterone blocker, like a pill.
Hmm.
And I had had the blocker injection twice because it lasts like about 3 to 4 months at a time. And so I had it twice, and then I had already turned 14. And so then from there, they just had me on the hormones because I was already starting puberty anyway. And so they were able to just put me on estrogen, and then I was on a testosterone blocker. And I was already on that for a few years. And I always say I started to pass like socially. People just automatically said she and identified me as a female when I was about 17 years old, was when I had enough change. And I still wasn't happy. I still would look at my body, and it just wasn't, even though I had a lot of changes because I started young, there was still something in me that I still didn't feel as affirmed as I thought I would by
Hmm.
it. Um, I just wasn't seeing enough change to that really satisfied me, and I still just didn't like the way I looked, and I still felt so much insecurity. I still just didn't feel better mentally like I thought I would. It definitely, like, I definitely don't, like, I definitely think it was a positive experience and that I am happy with things, like, and the changes I've had from it. But at the time, I think I was also just experiencing a lot of what people my age feel about their body as well. Like, that's a
Right.
pretty common thing for
The
17 year
awkwardness of
olds.
face, of course.
Yeah. I think a lot of 17-year-olds don't like a lot of things about their bodies. Um, so that happening for me, but also being in transition was really confusing because I was kind of basing it all on I'm not having enough changes with the hormones, when in reality it could just be maybe I'm just having body image issues.
Right. So it was almost like you were, you were kind of like conflating the fact that, oh, I'm uncomfortable instead of, I'm uncomfortable because I'm a teenager and
Mhm.
I look in the mirror and I feel fat, even though I'm not.
Yeah.
Instead, it was like you're going through this whole transition phase and you're going through basically the early stages of fully transitioning and you're
Mhm.
confusing just regular insecurity for I'm insecure because I'm trans and I haven't gone far enough.
Yeah, absolutely. That's exactly where my mental state was because I reflect on it now, and I think
Hmm.
that's really what a lot of what I was feeling was just insecurity with my body in general. But at the time, being on hormones, I was really going into it thinking that it would solve the way I felt about myself, like fully. And
Right.
I still had a lot of negative feelings about the way I looked and my body and just my presence within my body.
Yeah.
And it was from there that I knew I was like it's because I think I just need actual surgical intervention. I need things
Hmm.
done in order to make me feel better and to make me feel the way that I want to look.
And at this point, in at this phase in your life, do you have any friends? Did they have any sort of questions about what we were going through, what was going on in your life? What was your social dynamic like at this point in life?
Yeah, it was very isolating. I started technically transitioning like the end of middle school, like because I was already starting to like socially transition. People didn't know I was trans even. I just started to change my appearance to be, I guess, more androgynous. So I was already a boy that was wearing makeup and like dressing more feminine. Um, so then when I actually started like getting more serious into the transition, my family and I decided to go to a different high school. Um, and so we moved in with my new stepdad at the time because my mom had left had left that last guy. That was pretty negative, and now my current stepdad, and he's still here. But we moved in with him, and he had suggested because this was where his kids went to high school, so I switched school districts
Hmm.
and I went to high school there. And this was kind of a way for me to kind of start over. People wouldn't have already known of me as a boy in another name for so long. I
Right.
could just come here, be be Brianna, kind of have a more of a clean slate.
Right. It
Um,
was a new start, fresh start.
yeah. And in reality, it wasn't so much of a clean slate. I mean, people didn't know of anything really about me beforehand, but everybody knew I was trans. That's all they knew.
Right, because you were
Um,
still in that like androgynous phase type of.
Yeah, absolutely. Like I had just started the hormones, and so I still looked very clearly like a boy that was just very feminine.
Hmm.
Um, and it was already a conversation even before I started school. I didn't know it at the time, but I did learn later on that like that was a big thing, like within the school board and even in the community, that there was going to be a trans person that's transitioning, like starting high school, like at my age. And so it was like a big deal because no one in the high school that they knew of at that age had ever come in as trans or started transitioning or anything. Like it had never been done in that school before. And that was when like my mom and I had to sit, like we went and like sat with like the principal and everybody and talked about like the bathrooms because we didn't want me to feel unsafe or uncomfortable. We didn't want other people to feel that way either. So we kind of just came to the consensus that like I would use like a teacher bathroom. But it was towards the end of high school I started using the girls' bathroom because I passed enough
Hmm.
and nobody really cared. Um, but yeah, so but back to like the point of like my friends and stuff. It was very isolating. I didn't really have any solid friends until the end of high school. Um, just because being like the only trans person in that school and in that community, like nobody really associated with me. Um, I wasn't able to make lasting friendships. Like people just didn't want to. I don't know. People just it wasn't. There were certain things that were like more deliberate, like oh picking on me and like being teased and stuff. But it was just you can feel it in the environment. I felt it. I felt really shunned by most of the people around me, and that they were like, we don't even know what you are and what that is.
Right.
Um, and so I just felt really alone in that entire process. And it wasn't, I didn't really make solid friends up until the end of high school, like right at the end. Hmm.
And so
And
who would you go ahead?
oh, yeah. And so I was just going to say, like, when I made those friends, they were very fortunate enough that, like, because one of them was gay, but then, and so, like, there was one guy in that group of us, he was gay, and then there was other girls. And they really saw me as, like, their own. And they didn't even, like, it really rarely came up, honestly. Like, I will say I was just so grateful for that. And I'm not as close to them now, but they were, like, those girls really saw me as just another girl. And we were, like, I didn't feel, I wasn't made to ever feel like, oh, there's us and then there's you. And that, and even though there's differences between us, like, we all treated each other the same. And
Right.
so it was really, it made me feel like people were just seeing me as a person and not like, oh, this is that trans kid.
Right. It's at this
Yeah.
point where you kind of start to, find your own and find a group of people that,
Yeah.
start to see you, as
Mhm.
a, coming adult, and, you're
Yeah.
coming into an adulthood, and you're kind of starting to meet people that maybe don't agree with everything that you're doing in life, but they don't
Mhm.
really care enough to other you because they care about you.
Yeah.
And
And
it's like that.
I was also definitely passing at that point.
Right.
Mhm.
And so, going back into the transition aspect of things, I know that one of the things that you mentioned extensively was a very specific, and I mention it because this is from what I understand at this point where this starts to happen, 17, 18, 19, where you start to kind of actually make the big changes on your body.
Mhm.
One of the things that I remember that you mentioned was a very specific promise made by the doctors regarding you becoming basically a biological female. Can you talk about that?
Yeah. So one of the things that was really prominent in the conversations and the messages to me, and especially my mother more than anybody, was that by starting as young as possible, like I was told I was going to go through female puberty.
I remember you saying that they were
Yeah.
going to make you identical was the word.
Yeah, so that was to the surgery, for the bottom surgery. That was specifically what the bottom surgery, one of the conversations we had was that they were telling me about how the new procedure, like the form of the experimental version I was going to have, was that the tissue that they were going to use, they told me that like under a microscope, it was going to be identical.
Hmm.
So like the actual organ inside, like if you were to put I guess the cells under a microscope and compared it, they would look identical. And so that was in relation to the bottom surgery. But in terms of like becoming biologically female, that was that was more so in the conversations of when I started hormones and I was on the blockers. They had told me that because I was starting at this age and I was going to
Mhm.
be fully on hormones as I went through like all of my puberty, that I was going to go through female puberty was what I was told. And so I think that I think that also could have contributed to that mindset of like why I was so still unhappy and uncomfortable with my body was because I'm like I thought I thought I was supposed to go through female puberty and it
Right.
doesn't feel the exact way that I thought it would. It doesn't feel as natural as I thought it would.
Right. You're going through bodily changes, but they're not really what you expected. You're seeing the other girls in your grade level maybe
Yeah.
developing breasts at a certain point. They're going
Mhm.
through specific issues. They're starting to
Mhm.
menstruate. They're, such and such. And of
Mhm.
course, at this point, being told that they were going to be able to make you biologically female, and, a little forward in the conversation, we'll discuss that, but being told that they were going to make you, surgically identical, Of
Yeah.
course, you and your parents at this point are under the impression that, this could be done and this was going to happen
Mhm.
and this is something that could be done that they were going to be able to do. They painted it to you in a way that, made even your parents as adults think, "Oh, this is fully possible."
Yeah, absolutely. Like that was really prominent in our messaging, like to us, was that that by starting so young and by being on the blockers and being on hormones throughout your puberty and then having surgeries, like you were going to like you're going to go through a female puberty and then you're going to be a biological female by the end of it. And even though, like, now we all look at that and we're like, "What are you talking about?"
Mhm.
But at the time, we didn't know anything about trans people.
Of course not.
Even trying to find, like, a lot of conversation about trans people online was not prominent. Even in 2014, like, 2013, around that time, like, it just was not a conversation that was really being had, like, really in depth or even in a critical way, or even it was so many just different pieces of it throughout the internet, and it was just so scattered, the information, trying to find it, and so we were really all in on the doctors, like, fully guiding this process.
Yeah, and I mean, I can imagine, like, again, I kind of mentioned it slightly earlier, but it's like, you're going into a medical facility where, these people took a fucking oath. Like, these
Yeah.
are medical professionals who took an oath to do right by you and, do no harm to you as a person.
Mhm.
And very early on, it seems like there was a very high level of negligence that they came to your situation with, a high level of negligence and ignorance, to be honest with you, because it doesn't sound like, I mean, you said it within 30 minutes. It doesn't sound like there was
Yeah.
ever really an opportunity to seek psychological intervention. Like, I think that,
No.
I think that having the conversation that we were having earlier of your upbringing and asking you about, the dynamic that you were in, like, I'll
Mhm.
touch on this a little later on towards the kind of like the end of the conversation, but we have people like Jeffree Star now who, appear sometimes female, but they're not female. But getting
Yeah.
too ahead of ourselves in that regard. But I do want to ask you, like, going back into and really, I should say, going into, you know, the surgery.
Mhm.
I know that a lot of trans people decide not to get bottom surgery for a multitude of reasons. You were very young at that age.
Mhm.
You touched on it lightly just a moment ago, but how did you and your parents come to the conclusion that bottom surgery was the next step to truly affirm you? How did that happen?
I had already known that I was going to for a while, because and I also, like, acknowledge, though, that, like, this also could be just in part of the content that I was seeing, and I also admit that I had a lot of dysphoria with my genitals as well at the time, all throughout being a teenager, and all throughout my transition. I did not like that part of myself. I hated having to tuck, and I hated having it there, and it made me so uncomfortable, and I had always really desired to have something, like, surgically done about
Hmm.
it,
Right.
and it also felt like a and even though now I have more awareness of, like, what people do and don't do in transition, and I know it's different for everybody, I was also under the impression when I was a teenager that was like a that was like a step in the transition, that was, like, one of the last steps, and then you're fully transitioned.
Right. It's almost like a checklist that is kind
Yeah,
of
absolutely, and I absolutely thought that that was a big part of it, and I mean, I knew of people that didn't, but I just felt like that was something that everybody wanted, and it also was something I really wanted, um, and I just didn't also know I guess how am I trying to say this? I also just didn't have a full, clear idea of what it was like.
okay.
Because trying to find, like, anybody that was sitting down and going into long detail about what the process was to get the surgery, what did you do to prep? How was it like the day of? What did you do in the hospital? What was it like when you went home? It was really hard to find that. I mean, I had maybe found one girl on YouTube that talked about it, but she would only answer a couple questions in like really short videos. It wasn't like a sit down, I'm going to tell you the story. It was more so like she did like little 10-minute subject videos about different things. And so that didn't really fully paint a clear picture either of what I was going to expect. And so I really just trusted in meeting with like Dr. Gallagher and meeting with like meeting with a surgeon to really kind of paint that picture for me of what it looked like. But I knew that I was something I wanted to explore because I did have a lot of discomfort with that part of my body at the time.
And now as an adult, and I don't want to press you too much on this because I understand the gravity of the situation and the conversation. But in hindsight, as an adult now, do you think that maybe your negative sexual experiences maybe played a role into you not appreciating your genitalia as it was?
And so this is a really good question. And I challenged myself a lot in thinking about that because I think a lot of times, and I understand that for a lot of people, and then specifically trans people, it can be, they interpret it as just being really hurtful to question their identity or to even ask questions about it. And I do understand that. I understand that it's a personal thing, and so I get it. But I think that it's also really necessary for us, and I think that we do ourselves a disservice when we kind of shut down those conversations. I think that there's something there I see on like a certain side of it with trans people where it's like if you're trans, like, and questioning it is just invalidating somebody and it's rude. But
Right.
there's a reason why in the LGBTQ community there's a lot of trauma, a lot of family trauma, a lot of sexual
Hmm.
trauma, a lot of things, especially the trans community. And I think it's very prominent that like it's hard pressed genuinely to find a lot of trans people that did not have negative experiences as a kid. And I think that it's really negligent and a disservice for us to not acknowledge that.
Right.
And because if you look at what happened to me, all of that stuff kind of piling up, and then the trans identity pops up. I don't think that that's without coincidence. I don't think that that's just merely a coincidence. Even though I had behaviors already and I was having thoughts even since I was 7 that something was there or something was off with my gender, or that I was just behaving differently than all the other boys around me. But I can never give a full yes or no just because I think being trans is very complex. I don't think it's fully nature or even fully nurture. I think it's a lot of things. And I think that it's just too complex of a mental state for us to fully put into its negative experiences that cause it, or there's people, or you're just born with it.
Right.
Um, I think that it arises in many different forms, in many different ways. And I mean, you can see that just in how some people don't even want to change their body and they think they're trans, or some people want to do some things and they don't want to do others. But there are other people that and honestly, for me, I wanted to fully transform my body. Um, but I do genuinely believe that I think it did play a part. Um, But that doesn't mean that I don't have gender dysphoria. I was diagnosed with it, and I don't think that that was incorrect.
Absolutely.
But I think that that does play a role in it developing in me because even though I've had negative experiences with my transition, I'm happy I transitioned. It was a good thing for me. I enjoy being perceived as female to the world. Like when I'm outside, people say she, and I like being seen that way. I like presenting in a feminine way. I've always been a feminine person, and so it makes me happy to live like that. Um, but I do acknowledge though that there is a high possibility that that's what could have kicked off my gender dysphoria and what could have made it even arise. Absolutely. And I
Yeah,
don't
and I
think
mean,
that that's me trying to say that like trans people, that's one thing that's a bit frustrating. And I don't mean to, sorry to go off on a tangent,
no, go ahead.
but I think it's just so important for me to say. I think sometimes it's hard because I think people misinterpret me as saying that being trans is wrong or that this is proof that being trans isn't a thing. These people just
Hmm.
have mental illness, or these people have
Right.
mental problems, or they have trauma. That's not really what I'm saying when I say that. I'm saying that that is a very likely reason that it could become a thing in a
Absolutely.
lot of us. And that doesn't mean though that we all shouldn't transition because of that. And we just need therapy. I think a lot of us do with that, with now having gender dysphoria for whatever reason. There are trans people that it is in their best interest to transition. And I'm very happy that I did transition.
Yeah, and I didn't ask you that question in a sense of like, I want to get an aha moment and, oh, this is the reason
Yeah.
why.
Mhm.
I ask you because, you know, for even just victims surviving sexual assaults, they become very uncomfortable with their genitalia.
Yeah.
It's just something that happens. And I think that we can't have the conversation and the argument of, well, being transgender, people are transgender because of a mental condition called gender dysphoria.
Mhm.
We can't acknowledge and highlight that and not say that there could be things that create or even bring that up. I mean, it's commonly known that
Absolutely.
it's
Mhm.
coming, and this is maybe something you can bounce off of. It's commonly known that people who have schizophrenia don't have schizophrenia, a lot of them, their whole lives. Something happens to
Mhm.
them and boom, it's like a
It's
light
on there.
switch,
Mhm.
that something that act literally something that caused it.
Yeah,
And
that
so
actually
I
happened to a
I
family
would
member of mine. Yeah.
right, and so I would
Mhm.
imagine that if we're talking about a mental condition, something that is brought up by, something that we have yet to understand within the mind, I don't see it as far-fetched that something can bring that up. Something, the perfect conditions can
Yeah,
create that to happen. You know what I mean?
absolutely. No, absolutely, and I'm so glad we're talking about that because that and I only it kind of did that explanation because it just shows you how I think this conversation has become way too black and white. Like it's two sides of it trying to push it into being one thing or another.
Mhm.
And that is such a perfect example of like this side of it and why it just isn't. Because there are some trans people that have said, I did not have any experiences like that. And I knew of my gender identity very young. And there's a lot of us though, and there's a lot of people in the LGBTQ community in general that have things happen in childhood or sexual things happen in childhood that are negative. And so I think that it can be a combination of all of those things. It can be a combination of some of them. I think it's a very real possibility, and I don't think it's in trans people's best interest to deny that there are potentially a lot of people that do have gender dysphoria
I agree.
or don't even, or maybe believe they do, that it can arise from those experiences. And it can, like you were saying, it can kind of really take form when
Mhm.
there's triggers or there's things that kind of push you into that mindset that really kicks it off.
Right, in
And
the
it doesn't
perfect
really grow.
environment. In the
Yeah,
perfect environment, it's a breeding ground.
yeah, because when it kicked off for me, it hasn't left. Mhm.
Yeah, it's something that follows
Never in
you.
this process at all have I thought, maybe I do need to detransition, or maybe like I think about, oh, like what could my life have been like if I had not transitioned at all, or if I had stayed male. I think about that, but I never think of it in a way of, wait, maybe it's time to detransition. Like I've never, like the gender dysphoria is still there.
Right, and
Mhm.
I think that's like a natural progression of things when you have like a life before the life that you have now. I think
Mhm.
it's natural to be like, "Oh, what could have been if?"
Yeah,
Like, I don't know, what could have been if I didn't tell my parents that I was gay when I was 11 years old, which
yeah.
we relate in the sense that we both told our parents
Mhm.
about our situation pretty young. A lot of people are surprised when I say I came out when I was 11 years old, but I did. Came out
You
pretty
knew the
young.
truth. Like,
Yeah,
go
I just
ahead.
knew the truth, girl. Like
Yeah, and like I told you, I knew I like even though like I was still boy at the time, like I knew I liked boys since I was like 7. Yeah.
Absolutely.
So I knew that just like a lot of us do. We know our sexual orientation pretty young.
Right, and I do,
Yeah.
and I'm so glad that you said that. And I'm gonna look at the camera for this one. I do this every once in a while when I want to make
Mhm.
a point. I want to make it very clear to people who are watching, because immediately to what we just said, people are gonna say, "Oh, so that means that you knew that you were trans from an early age and that children are allowed to transition? Are you conceding that you think children should transition and children should be in gay environments?" No, what we're saying is that we had an inclination that we were part of the LGBT community at a very young age. We're not saying that you should be allowed before 18 to make the decision to change your body. So
Yeah.
let's make that differentiation pretty quickly. That we're not
Right.
saying that just because we knew that we're like, oh, okay, well, Brianna would have decided to do her transition at all of it at 11 years old. That's not what we're saying at all. So I want to make sure that that's clear. But
Mhm.
diving back into the conversation, this is the part of things where I really do want to talk about the surgery itself and the procedure, the process. I really want you to talk extensively on this experience with your bottom surgery because you know most people that know about this conversation know about I believe it's called the penile inversion. Most people know
Yeah.
about that, where it's,
Mhm.
for to save the viewer how graphic it is, it's split in
Right.
half, inverted. So,
Literally. Mhm.
right. So, yours was a little different though, because you
Mhm.
had an experimental procedure. So, can you speak a little bit on this miracle surgery that they promised you? Because, like I said, you had a very specific procedure. So, can you tell us
Mhm.
about the procedure itself, of course, and why it was recommended to you?
Yeah. So actually, this technique one was not offered by Dr. Gallagher. I believe Dr. Gallagher only does penile inversion.
Mm-hmm.
Um, but I had a consult with Dr. Gallagher, and we kind of just talked about it. We didn't even set a surgery date or anything. And then she had emailed me saying that she was relocating to Miami. And so she was going to refer me to a surgeon that studied under her at one point, and his name was Dr. Joshua Roth. And that was how I got into contact with him. I had a consult with him and we talked about I will never forget, he handed me a blue piece of paper and it was basically the three different techniques that he could do. And I had heard of two of them. I had already heard of penile inversion because I had talked about it with Dr. Gallagher. And I had heard of online the sigmoid colon, which is where they basically take a section of your colon and use that as the organ. Um, but then he showed me that there was something called the peritoneal pull through vaginoplasty. And he said that this would be really ideal. It's the newest form of the surgery. And it kind of, the way it was shown on paper was that it kind of resolves some of the issues that people have with the sigmoid colon. And that one of the biggest concerns with the sigmoid colon is not only is it's very invasive, I mean, it's all invasive, but I mean, it's literally like removing a section of the body and then putting it somewhere else.
Right.
Um, and one of the complaints of that is the smell that people have for a long time. There's also other issues like you could be on a colostomy bag. I just heard a lot of negative experiences that can happen with it.
Yeah.
And so this surgery was kind of shown to me because we had talked about how the penile inversion wouldn't be ideal for me because basically this is kind of like an estimate of what they say is that when you have penile inversion, your depth internally is based on the length of your penis. Um, and they said typically the depth is about 2 inches removed of what your penis size is if you have penile inversion. So, for example, let's say somebody's about 7 inches, right? Their estimated depth with penile inversion would be about 5 inches. That would be their inside depth. And so, and this was because I was on blockers and I was on hormones, there wasn't a lot going on.
Mm-hmm.
That's just part of it. You just don't
Right.
develop that being on not only, and I wasn't even on blockers like an extended amount of time. It was 2 injections that lasted about, I would say, like 6, 7 months before I started hormones. But being on that, you're not going to develop male sexual features.
Right. Because you're
Um,
not going through male puberty.
yeah, exactly. But I also don't have a female reproductive system, so that kind of the whole reproductive side of your development just kind of is in like a limbo
Yeah, it leaves you in a
as you go through
standstill.
puberty. Yeah, absolutely. Because I didn't really develop sex drive or sexual feelings, really sexual motivation. Um, and I also just, you don't develop physically in that area as much either. And so it was really not ideal for me to have penile inversion. It was pretty much guaranteed I wouldn't have much depth internally. And they said it would probably be pretty difficult to do. Um, so that was where the peritoneal pull through kind of came into the conversation, and it seemed like a really viable option for me. It was new, and it seemed like it was going to have all the benefits of doing a sigmoid colon, because there are some benefits with it, like lubrication and stuff like that. Um, and it seemed like it was going to have those benefits without some of the negative sides of like a possible colostomy bag, digestive issues, and the smell. Um, and he said that, yeah, this, and also that tissue is also the same as like a vaginal lining. And so that was where that came up, of like looking at it under a microscope and saying that it was like near identical. And so that really put the idea into my head that like this was going to be like really like a fully functioning like female genitalia, and that it wasn't just going to be like something kind of similar, like it was going to really become that.
Right,
So
like
that
they
was how,
painted.
yeah.
No, go ahead, go ahead.
Oh yeah, and so that was just how I got into contact with Dr. Roth, and that was how that conversation about the surgery went, and how we landed on the peritoneal pull through. Mhm.
Right, it sounds like they kind of set things up in a way for you to it was set up in a way that it was difficult for you to refuse. It's like you're basically
Yeah.
given a miracle and somebody hands it to you and says, "Oh, do you want to keep it or not?" Obviously, you want to keep it. So,
Right. Mhm.
I mean, I would imagine that it would be like an easy, you know, an easy choice for you as a person.
Mhm.
Obviously, in hindsight, there's a lot of things to that, but were you told, you spoke a little bit about the negatives, but were you told about the adverse health risks, things that could actually happen, not, oh, maybe this will happen XYZ. Were you told about those things?
See, and we talked about complications and risks, but we had a conversation of like, oh, you'll be in the hospital, there's bleeding that can happen, you can have something called a vaginal stenosis. Like, he definitely went and talked about like the different risks and things that can happen, but it was downplayed to me quite a bit. And I remember us having the conversation of, oh, you are so young, you'll heal a lot better. People that are young tend to have a much better recovery. It shouldn't be too bad for you. And so even though like I knew that there were definitely risks, and I saw that on the paper. There was like a list of things that can happen, but it didn't fully paint a picture of even really what recovery looks like. It was kind of talking about like, oh, you could have bleeding, some urinary, like what is it, like urinary incontinence or something like that, or like different risks. Um, but there was also the conversation that I was so young that I was going to have a much better recovery the younger I did it. And so that, plus already just having so much dysphoria with that part of my body, and seeing this procedure really being the only ideal one that I could do, um, it just seemed like absolutely the right decision. It seemed like it was truly going to be a miracle.
Yeah, absolutely. And I mean, like I said, I've already mentioned the fact that they painted it really well for you, but it
Mhm.
almost sounds like, we're all used to seeing the commercials for medications on TV where they're like,
Yeah.
it's gonna save your life and it's gonna cure this and it's gonna cure that.
Mhm.
And then like you go to the last like 5 seconds of the commercial and they're like diabetes, heart disease, death. So
Yeah.
it's almost like they told you the pretty parts of it and then they kind of mentioned the necessary parts to kind of help them kind of avoid a lawsuit,
Yeah.
and that was that, and that's kind of where they shut things off.
Mhm. Yep.
Yeah.
Yep.
I just wanted to ask you specifically, talked about the choice to do this specific surgery, but how soon after making the decision to do this specific surgery were you on the operating table?
Maybe like 4 months? Yeah, I think it was about
Wow.
4 months. I had that first consult with him, yeah, in December, and then the surgery was, yeah, surgery was beginning of May, and it was like the end of December, it was like the end of the year, so it was really about like exactly 4 months. Mhm.
Wow.
Right after that appointment, where we kind of had that consult and talked about it and settled on the peritoneal method,
Hmm.
then immediately it was sent for insurance approval to get pre-approved, and it was, within about 2 weeks, and so then we plan the surgery date.
That is, you know, besides the obvious, just the concern of how quickly that happened. Besides that, we live in a country that is constantly criticized and judged for the way that our insurance works.
Hmm.
And there are people who are not able to get kidney transplants or not able to get certain procedures done. First of all, because things are expensive, and two, because our healthcare system has a lot of issues.
Hmm.
And people aren't able to go ahead and get these surgeries, get procedures for years, for months. And you were able to get a life-changing procedure in 4 months. And that's, again, besides the obvious fact that it's a very small amount of time to change your life so quickly, it is wild that something that I mean, I don't think that you would disagree on this, something that is elective surgery
Hmm.
would, so quickly get pushed through the system of insurance. It's almost like they know that they could make money off of things in the long run.
Yeah, absolutely. And and that's one thing I'm not fully informed on, really all the complexities of like getting things approved with insurance. That was really the first time I had ever done that, like getting something approved through insurance. But yeah, it was a fast turnaround. Like it was submitted really quickly and we got it back within about 2 weeks, that it was all pre-approved to do.
Wow.
Um, and no, you're absolutely right. Like I wasn't fully aware that people struggle so much to get things covered and to do this and that. I mean, I knew our healthcare system is a nightmare. And that things are always crazy expensive, but that was something that went pretty smoothly, was the insurance process.
Wow. And can you, you know, of course it takes, 4 months about to get you on the operating table, but specifically on that specific day, can you describe your mentality to us? What was your mentality like leading up to the surgery day and on surgery day itself?
Yeah, it finally felt like I was gonna be a normal person. It felt like I was finally gonna feel the way I always wanted to, even though like I had started hormones really young and then I had other surgeries like the breast implants and things that definitely feminized my body. I still like it was just still there was always still something incomplete. And I think it was just that dysphoria with my genitals still being there and so strong that it felt like the final piece of the transition. I felt like I was going to be done. I felt like I was finally going to be done. I wouldn't have to be thinking about being trans all the time. And I would just be able to be a normal person and just be a normal girl. I wouldn't have to be thinking about, oh, like, are people like, I got to tuck when I leave the house and I got to make sure, like, I finally felt like it was going to alleviate all of the noise of gender dysphoria in my head. Um, and so it felt like finally like a dream come true that I was finally going to be in a normal body. And
So
so
you
that
were
was
you were
worth it.
excited, you were hopeful. There was there was a sense of excitement in you. You were maybe even kind of maybe even a little nervous at
Yeah.
possible maybe a possible complication of, I don't know, having to take a little too much Tylenol or something innocent, I'm sure is what you expected, before something like
Yeah.
that.
Like I knew it was definitely I knew it wasn't an easy procedure and I knew that I was definitely going to be recovering, but it just seemed like that's just part of it. That it's just like, oh yeah, you're not going to feel comfortable after like a surgery like this and you're just going to need to be at home, take it easy.
Right.
But then after that recovery, like you're just going to be on like it's just going to be an upward journey and it's going to get better every day and that was yeah, I mean, I knew it was gonna be hard initially, but it felt like, yeah, it gets better every day after that, and so it's worth it in the long run. Mhm,
Absolutely. And can you, what was the surgical process itself like? What specifically was going on that day?
mhm.
It's for most of us on days of surgery, we're nervous simply because it's nerve-wracking to be under anesthesia. And for you it's a little different because you had a 7-hour reconstructive surgery. So
Yeah,
what was that like? What was that day like?
and he said, "Well, I think you can still have sex with that." And so it was already right away kind of dismissing the idea that something wrong was happening. And he had me come in and he did something called a vaginoscopy. So it's basically a colonoscopy, just the vagina. And he went in with a camera and looked at it, and it was scar tissue inside of it. And so he said it's going to close up no matter what.
And that concludes part 1 of my interview with Briana. Remember, part 2 will be up at 8 p.m. on Sunday night. Remember to like, comment, and subscribe. Make sure that you hit the notification bell so you're here for part 2. You don't want to miss it. I'll see you soon.